Joint is another complex joint in the body made up of several units of joints. What most people refer to as ankle joint is actually the joint between the tibia and the talus. Okay? And that is called talocrural joint. This joint. That's talocrural joint. Okay? Talocrural, or maybe some people call it tibiotalar joint or talocrural joint. That is where dorsiflexion and plantar flexion take place. Dorsiflexion and plantar flexion take place in that joint. There is yet another joint. Can you capture it, please? There is yet another joint between the talus. This is the posterior aspect of the talus, and this bone entirely is called calcaneus. So there's a joint here. That joint is called subtalar joint, and that is where inversion and eversion take place. But this bone is fused, it's not moving the way we want. So when you turn it like this, you should get inversion. When you turn it like this, you should get eversion. You need to have this knowledge of anatomy before you do the mobilization. So we have job to mobilize the talocrural joint to gain flexion, dorsiflexion and plantar flexion. And then we have to mobilize the subtalar joint to gain inversion and eversion. Then we still have some other accessory movements around the ankle joint. We still have some other accessory movement. For example, we have the talus here, then we have the cuneiform, then we have the medial cuneiform, we have the middle cuneiform, we have the lateral cuneiforms. Do you understand? If we move these joints, yeah, it's a form of accessory movement. Once we are able to move them, we're going to have more movement in the ankle joint. We're going to have more movements of inversion and eversion. Then we're going to gain a bit of supination and pronation. You know, we have supination and pronation in the ankle joint as well. When it's tending to be like this, that's supination. When it's tending to be like you're standing on the lateral aspect of your foot, that is pronation. There are little accessory movement that must not be too much or completely absent. Otherwise, there will be problem with the ankle joint. Are we good?